So, so yeah. So let's talk about interests. All right. So interest this can easily be described as just one stake or a group stake or involvement, or it could also be seen as how a group or organizations have something in common or have a common concern, common goal, common agenda, common intent on a particular issue, or in this case, you're bringing it within the context of policy. So, and it could be there are two areas of or two kind of interests you can think of. It could be from the economic or financial lens, could also be from the political lens. For instance, from the economic or financial lens, maybe thinking about how one wants to protect their economic advantage, or how one wants to advance or get the economic advantage. Maybe there are some resources allocated to, maybe there are some resources allocated to, let's say, hospitals, for instance, since this is a health policy on health costs. So let me use the hospital example. Assuming the government has some money set aside, some funding for hospitals and other facilities. So different hospitals and different organizations may want to advance their interest by wanting to get what they feel is due to them. So in this case, that is their interest. That is the position that they want to protect or what they want to achieve. So it could also be from the aspect of from the political or social lens. It's about trying to exert a kind of privilege or trying to maintain one's privilege or trying to at least find yourself in a better position in the system. So oftentimes we'll notice that one is likely to want to act when they feel that their interest is threatened, or maybe act in something that benefits them. So let's look at the example of uh, last week we talked about the healthcare system, but today we're going to talk about the MAID. The group presenting will talk about the medical assistance in dying, and obviously it's still about people's interest. Although the people who will present the group that will present next week will talk about the rights, the right to disengage or when it comes to in the workplace, some individual or the healthcare and other organizations, in fact, all organizations, especially in the province, there's this right to disconnect that after work hours, the employees have the right to disengage or disconnect from the system. So the employers at that point have they have no right to make the person to work extra hours or even to receive calls or answer their calls after the work hours or do any work related activity. So in this case, that policy is trying to advance the interest of the workers who may be exploited by employers. So, and for something like that that benefits the employees, sorry, as the workers, they would want to protect such advantages. So I'm just trying to use these examples to flesh out our understanding of interest. So, so in terms of advancing interest, interest can be advanced in different ways. How are interests advanced? It could be in the form of pressure groups or activist organizations where people mobilize or gather or organize themselves around a particular issue to advance a particular cause. So here, imagine it was just one person trying to achieve something like, let's say, the right to disconnect that I talked about, I mentioned, I even made. or having a more integrated healthcare system, like the group that presented last week talked about. So if it was just one person trying to advance such initiatives or such causes, you would imagine that it would be difficult for them to achieve that goal. But if it turned out to be more than one person's or more people who are, when there are more number of persons trying to organize around that issue, and also when they are well resourced, when they have all the financial and human resources to advance, even the position when they are well positioned in the system for that particular idea or initiative, you would find out that they are likely to achieve the intended goal compared to if it were just one person or fewer persons. People are also people who do not have the resources to organize and move for attaining such an objective. So that's about now they have come out together and they form what might be seen as pressure groups, or advocacy groups. And then there's also the aspect of consultations. That's another approach for interest can also assert themselves through consultations on a policy area or policy issue. Let's say it could be the government and other organizations or other groups in the system. Let's say um the government may want to enact a policy or a law, enact a law and or want to formulate a policy on a particular issue. Yeah, they would likely consult with the academic researchers or and also, very importantly, even the citizens. There are also opportunities um for the public to also come and air their views and share their experiences and share what they want. So these are consultations, these are ways that perspectives, ideas, how a robust and rich policy may be enacted through consultation. So they consult experts, they consult different interest groups, they consult people from the public. Yeah, and then the next one is about mobilization. So mobilization here it simply means people coming together on a particular issue, trying to set up an organized effort, trying to mount an organized effort on a particular issue. So I also, in the subsequent slides, I'll go through some examples of how people have mobilized over time on certain issues that affect them in one way or the other. Yeah, there could be mobilization. There are some issues may be seen as good or bad. So, and oftentimes one of the readings we had this week talked about how the framing of an issue can affect people, the way the public, or even the appeal of the policy to be enacted and who will be favored eventually. So, for instance, if a particular issue is framed like the example we had in the reading about how um, the the some food manufacturers or some other big corporations can frame themselves as being altruistic, being trying to ensure that the shareholders and not just shareholders, but also that the public, believing that the public has a stake in their company. So if any policy by the environmentalists in a bid to trying to limit some of the operations for them to comply with the green and more environmentally friendly um, ways of doing or means of production. So it may affect their operational efficiency and affect the way they do things and affect their whole procedure altogether. So it may stifle some of the liberty to maybe to be more productive, and there are many ways to frame it. However, so one is about some of these environmental policies trying to limit their operational capacity. Uh, whereas another aspect was like, oh, the environmentalists themselves are they have this elite. These companies argue that the environmentalists have these elitist ideas of ways of saying things, of ways of so they are not necessarily protecting the interests of the public, rather they are protecting the interests of the elitists and certain groups and trying to affect or limit their production capacity. So I'm just paraphrasing the whole ideas. I know if you read the article, you would understand what I'm talking about. So it's about framing, how the way an issue is framed might protect or defend or even privilege a particular interest group over the other. And if it's also framed in the other in the other way around, it may also privilege the ones that may have been repressed or, or at disadvantage initially may turn out to become the privileged group. And that's the power of framing. So, however, there's also another aspect of concentrated and diffuse interest, or whether the cost is concentrated or the benefits is concentrated or diffuse. Or we'll talk about this in later slides. So I know you're or some of you may be familiar with this. Does anyone know what this is about? Yeah, Jai.
The community soccer thing that protests that happened in Ottawa during the COVID uh, times. I think kind of started to anti-vaccination beliefs and turned out to a bigger like individualistic
Yeah.
sentimental group of people.
Yeah, correct. Yeah, that's true. And this was in 22nd of January. I think that's 2022, up to um February 23rd, 2022, where the truckers were trying to protest against the cross-border vaccination policies that they were mandated, or the transborder between US and Canada. These truckers that do the transborder um, commutes were mandated to comply with a vaccine mandate, and they felt it was forceful, repressive, and against their benefit. It impinged on their autonomy to decide what to do with their body or what they want to get injected into their body. They had the right of with the Charter of Rights and Freedom means that they have the right to decide to take a vaccine or not to take a vaccine or anything whatsoever. So they eventually protested. It lasted for a month plus. That's 22nd of January to 23rd of February. So, and basically, even from the matter, their issue on their agenda in, grew beyond just the restriction for them themselves to be mandated to receive these vaccines, but they wanted to end all vaccine mandates. So that's how the thing just blew beyond their initial intent. And people who are aware of this story also knew how it ended, and how some of them, also even people who paid money to support them, also had their accounts restricted, and some people were jailed eventually, and there are other things. But yeah, they mobilized around this particular issue. So then, I believe most folks would know who this is. Anyone? Yeah, 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 yeah. Yeah, Greg Thunberg, and he's a climate change activist who is renowned. And even recently, I think sometime, or was it early this year? I think, or late last year, she was also involved in the Freedom Flotilla in Palestine. Yeah, but that was this picture. The picture we saw here was from September 2019. Yeah, so the mobilization is actually about organizing around a particular issue. Is that organizing efforts? the mobilization aspect. So whether the mobilization was something that led to protests is another thing. Mobilization must not lead to active full-blown protests. It could lead to having people who maybe, yeah, there's what is called organizing niche. That's simply about people running around on a particular topic area, on a particular issue that affects them, something that they can relate with. It could be a profession or a professional group organizing around that niche. The niche itself can be about an issue like the climate change, could be about the vaccine mandates or anything, but it's about people who share common interests. There's also what is called policy community and policy network, which is also some of you might also be familiar with that, right? So it's what is called issue network as well. So it's about rolling around a particular issue and the broader policy community also. It's about people who are from larger collaboration of people organizing or coalescing, a kind of a coalition around a particular area or issue. And then policy networks, that's beyond the scope of this course, because this is not real politics study, but this is more of introduction into health policy. So talking about pluralist network and all those kind of stuff is not within the scope of this course. So let's not go into that. But if you're willing to learn more about it, and also can talk about it or learn about. Yeah. So, but basically, what I wanted to talk about is about people mobilizing around a particular topic or issue. That mobilization, just keeping at that level. For instance, in September 2019, there were over 300,000 Canadians in Montreal. There was a Montreal march. They marched in Montreal around the need to take action on climate change. So that's the awareness that they try to raise and to force government or influence government to act. So, and then there's also the people also organizing around issues like autism, or like you can see some placards and with some of the things written there. They're basically trying to advocate for people who live with autism and their family caregivers, uh, trying to provide a better welfare and better care for people with autism and related disorders. And then also about, like last week, we talked about how the idea and about how the Canadian healthcare system is a national pride. And this picture also depicts people who also organizing around protesting in the parliament, premises about trying to save our healthcare, public healthcare. So this is about people trying to defend a particular position. It could be a position of privilege, and they will also talk about we'll still go into talking about the dominance, challenging, or repressed interest, which we'll learn from papers that hinted on the works of Alford. Yeah, so we'll still talk about them in subsequent slides. So there are types of interest. First one is about self-interest, which is often linked with trying to organize or trying to make known one's advocate about one's um economic matters. For instance, oftentimes o- people would want to take some positions that are related to what affects them most. However, initially I've talked about how an individualistic organizing in an individualistic way or trying to advance one's position that is personal may be seen as being selfish or and not may not even be able to make much gain much traction. But when more than one person is organized, when they are also well resourced, when they have enough public support or possibly clout, it may lead to moving things around, leading to some changes. So, but here, self here is mostly about advocating for one's economic interests or matters. And then there's also the other aspect of professional interest. So we know about different professional groups, even physicians and other healthcare providers and non-healthcare providers, and even in different workplaces. I know I talk a lot and I give a lot of health examples because I've worked in healthcare and I've been in healthcare across my academic and professional career. So, and I'm also open to learn more from other disciplines and professions. If you have examples that are relevant to any discipline that you are from, I'm also happy to entertain them. So, but here it's about people who have certain knowledge. What did I just, sorry. All right. It's basically about people who have certain knowledge. Um, Most times we know that the physicians have, or the healthcare providers, the clinicians, they have the kind of knowledge and have an advantage based on the knowledge that they have that the ordinary person does not have. And they share special power because of the knowledge that they have, which the public or the patient may not have. They enjoy special privilege in terms of deciding what should be done in healthcare system and what will become the dominant perspective, the dominant idea, which institution should be used to administer the system in general. So there's also this an example of an issue of might be in terms of this type of interest might be they might organize in terms of remuneration. We often hear about physicians or other healthcare providers trying to trying to negotiate with the province, with the government. We hear about all those negotiations. They want better pay, they want better work condition. We hear about high burnout rates. We also hear about some physicians, especially family physicians. We hear about how many family physicians or some family physicians leave their practice early or retire early. I don't know if you've read that in the news. Anyone? Okay, I see Julia nodding her head. Has anyone heard that as well? So that's mostly one of the arguments is that they have, it is actually known that family physicians have they grapple with a lot of administrative burden, a lot of paperwork and non-indirect patient care activities that consume a lot of their time and that are not well remunerated. And even compared to most of their physician counterparts, they are not paid as much as their peers are paid or their physician counterparts are paid. So there are some other issues here and there for sure. So they may organize in a way on advance a course to for better work condition or better remuneration. So also the public also, okay, you can go on.
Okay, like conflicting interest and that you could improve, like how are we supposed to like identify which interest groups are like driving those perspectives and like which ones as the public should sort of focus on?
Sorry, can you repeat the question again?
Yeah, so like in the news lately, there's like a lot of conflicting health. So even like in other industries, as well, there's a lot of conflicting opinions and feedback. So when like these different health groups sort of publish their own narratives, as the public ourselves, like who are we supposed to kind of listen to? We're supposed to like who opinion are we supposed to take?
Yeah, that's an interesting stuff. Even if you remember the paper that for week 2, the Movell's paper, if you remember about the masses or the mass public as this stated, if you remember that paper talked about how the masses tend to protect the physician's privilege or dominance in the system because of how they are so attached to they love or they've come to bond with their physicians and want to retain that contact with their physician. And even the system also reinforces that that particular phenomenon, because we also notice that the physician services is then, like the case of psychotherapy, if they receive psychotherapy from the physician, from your family physician or any physician, they do not pay out of pocket or any extra charge for that. But if they received the same service from a psychologist, they may pay out of pocket for the service, for that service. So it's still, the system somehow reinforces the masses or the patients or the ordinary citizen trying to maintain physicians' dominance in the healthcare system because of the institution that has been created and reinforced over time, and the way we've also learned to bond with the physicians. So, who we should listen to? I think one is about one is about understanding, and the layperson would likely not understand what is in their best interest many a times. And the powerful influence of the media also. The media is also a powerful tool, which we'll talk about in subsequent slides. The media is also a powerful tool that is used to advance a cause. They are used to frame narratives, they are used to shape narratives and to influence people to act in a particular way. So, but it was one of the things I learned when I was learning about learning about health policy and health policy analysis, etc. It's about how physicians are also effective in getting the attention and not just the attention, but getting the public to support their interest. They are so effective at doing that because they often have this relationship with their patients and they interface with them. But a critical person, the lay person, would likely support the physician's perspective because they want to maintain that contact and that therapeutic relationship with their physician. But it will take a more critical and more learned person to understand that in some issues, they may need to not tilt towards the physician's position, but look at the system in a more integrated and inclusive way. Other question.
Say that people tend to align with narratives that align with their own self-interest. Like in the end, it comes down to their own self-interest and based on that, they align with
Yeah.
narrative.
Yeah, of course. That's very true for sure. Especially when they truly understand what's in their best interest. If they truly understand what's in their best interest, of course they do. There's this rational choice theory that talks about how humans tend to the humans are inherently selfish, somewhat selfish. So they are likely to defend positions that are in their perceived best interest. So that is often the case. I don't know whether that was helpful. Yeah. Yeah, but in terms of the question that you can ask, obviously, with a critical person who is more learned and understand the healthcare system would likely want to look at the positions and the point of views of different stakeholders or different groups, and then decide based on their critical analysis what should be supported. But what we know is that the layperson may not be sophisticated enough to understand what's in their best interest, and often adopt the legacy position, which turn out to be in the healthcare system. It turns out to be supporting the physician groups. Another question. Okay.
So you have 4 types here. Would you say the first 3 types of professional and public ultimately boil down to social movement organizations? Because all of these groups kind of like try to lead some kind of a social movement from.
Yeah, so thank you very much. So the only distinction here that I wanted to clarify, which was why it's included here, the social movement organizations are often narrowed to a specific, these are organized groups who are narrowed to a specific topic or topic area. For instance, it could be about breast cancer, it could be about feminism, it could be about consumerism, which is basically about protecting and promoting the interest or what may be in the best interest of consumers or the ordinary purchasers out there. So it's often narrower, unlike the public interest that is more dilute and more centered on something that is general in scope. But when it comes to the social movements, organizations, it's often around a particular narrower topic. Like I gave the example of feminism. Yeah, that's a niche topic somehow that maybe women and people who are advocates and allies of women may defend or rally around or mobilize around the issue of feminism. But the ordinary person in the street may not be really be interested. But when it comes to something like clean water, having clean water or sanitation, that's something that more number of persons would definitely be interested in. And that's more of the public um category. Exactly. Was that helpful?
So
Okay.
I want to ask a question. So based on how you explain the whole thing, I feel like every one of it is interwoven. Because as a self person, if you have a particular interest, you try to bring more people to have that similar interest, which you definitely leads to the last one. I think that is what we are trying to communicate, right?
Okay, yeah, that's an interesting perspective. Yeah, for sure. Yeah, but however, there are some issues that are so personal. One wants to protect their personal economic interest. Your personal economic interest may not be the same as another person's economic interest. So that may be something that is just unique or peculiar to you. But we're talking about professional interest. Now, that's a professional group, like I gave the example of physicians trying to organize around better remuneration or better working condition. So that's something that is unique to a particular professional group. It could be a group of accountants trying to rally around a policy that maybe there's a particular software that they prefer that makes their work easier, and there may be a policy that bans the use of that software in a particular jurisdiction. They may try to organize to influence the government's decision to allow them to utilize such strategies in the accounting activity or any other profession. I'm just trying to go outside my regular healthcare example. So I don't know too much about accounting and other disciplines for sure, but I'm learning. So, but the bottom line is that it's about a professional group trying to work around or trying to mobilize around a group interest or something that an agenda that is affects the group and not just the personal financial gain. You might be, oh, our profession, everyone, most people in the profession, if not everyone in the profession, wants to achieve better pay for that particular group and not just a particular individual. Or it might be a better working condition, or it could be any other thing for that professional group. It might be about protecting the autonomy. Maybe there's beginning to be some role creep from other professional groups. They want to protect their autonomy. So that's like from a professional perspective. So see it as different layers, or and also see this one go from self to professional. This one is at the professional scope, and then then there's also the public, which is about something that is more general. Like the example of the clean water or climate change that I talked about. It's something that most folks can relate with. Let's say in the Houghton area region, we want to have better um a, better sanitation and sanitary condition. We want to have a more hygienic um environment, and we want to have curtail degradation to the environment. So that's something that is more broad in scope and more affects the general public, and it's something that everyone can easily relate to. Then, however, on the other hand, when we talk about the social movement organization, we're talking about a particular topic area, particular niche, or like the example of the consumerism that I talked about, maybe trying to protect some consumer rights or consumer interests. It can be about feminism, like the other example, trying to protect the interest of women and other things like that. You have a question, Julia? Yeah, I'll get to it. Yeah, we can go on.
public might relate to it. Would it though like be harder to mobilize because in the reading it says like concentrating tends to live more? Like, I think that kind of like, it's interesting that, because it's like, oh, it applies to people, but it's like less like, it's like when it's like policy change.
So, I think, so when it affects, although we're going to get to this scenario, but basically when something affects in fewer persons, maybe one person or more, when there are greater benefits to a fewer number of individuals, such a policy is trying to gain traction, or such in terms of organizing around that, small people will be interested to work around, or not more people who are involved. Can you imagine it's easier to organize in small group and then more difficult to also get other people's attention. So one of the ways to think about it is from the case of the diffuse costs. When we talk about the diffuse cost, an example would be, let's say, there's the vaccine, or let me use the public insurance that we have in Canada for healthcare. Basically, everyone contributes, and it's every adult contributes to the public financing force for insurance and public healthcare. So essentially, no one really feels the cost that much because we are just contributing just a small fraction of our income into the public via our taxes into the public insurance system, right? So it's something that like that. Any change in policy that does not really cost us much because we want to fund a healthcare program, but we're still funding it with the public force. We don't really care much. No, people may not want to ask that much, or the person opposing it because they don't really feel the. Assuming we were trying to increase the cost of insurance of raise the tax, then that would gain people's interest. But once the cost is still big, that fraction that we're contributing, people may not really be interested in. Well, yeah, it's nothing, just a small money. We don't really care. But assuming a particular individual has been asked to pay more for a particular procedure, let's say someone wants to do a hip replacement and they are asked to pay more money for that service, that it pinches them, it affects them, it touches them. So they may want to react. They are likely to oppose such a thing because it affects them. And then another aspect is that even when the costs and benefits are concentrated, or even assuming the cost is also diffuse but large, then in this case it's actually large. So that's how you can make it. But if it's not, if when it's actually about it being large in terms of this some, assuming they want to spread the money, but it's still high, then people will be interested and want to oppose. But if the cost is still, just assuming the cost is spread across the society, and it's just a little fraction of money may come out of everyone's cost, they may not really feel it that much because it's just a little fraction.
Well, different people with different socioeconomic class, people earn higher tax brackets, so people will feel it differently though. So
Yeah.
is there something to normalize that?
Yeah, I think I get your point, but we still know that we have a progressive tax system in Canada, right? Yeah, and so there are income brackets, and the higher you earn, the more likely that you pay higher amounts in tax. So but invariably, no matter how much is collected from the higher income earners, they still have more take home compared to people who are of lower socioeconomic status, right? So that's an interesting perspective per se, but it's still somehow equitable because still they are still able to they still enjoy some of their privileges or benefits for the kind of income they earn, despite the high taxation. Yeah, but I know it's kind of a little bit not so easy to explain this from the lens that you are seeing it anyway. But what I want to highlight is that in this case, assuming let's see it from this way. Let me just touch on this then. So this is just about concentrated. We're talking about effects are spread over in a small number of people, or it greatly affects a person's life, and diffuse is about spread over a greater number of people, usually not involving a major aspect of their life, person's life. So when it's diffuse, it's just like a small fraction, like I tried to explain, that it does not really affect one's life in a meaningful way. Yeah, but then when it is concentrated, that means it has some important, it has some tangible impact on the person's life or livelihood or well-being. So I know this is the table you're talking about diffuse cause and concentrated, right? This is what you're talking about. So let's say with the example we have here, talking about whether people will mobilize around when the cost and benefits are diffuse. For example, the example of pharmacare, where the idea is that through the public system, just like primary healthcare and hospital services are financed publicly, and also having the pharmaceuticals also covered in such a way. That means almost everyone in society and every taxable person in the society contributes into the purse. However, it's also the benefit is also diffuse because almost everyone, yeah, everyone it does not really benefit some persons that much or most persons that much, except maybe older individuals or person with particular health conditions. But for the whole population generally, uh, like for me, I know it's been a long while I took a medication. Maybe I did take some supplements for sure, yeah, once in a while, but for most folks, that's often the case. Whereas some persons, because of their health condition or some other reasons, they may need to take some drugs or different types of drugs depending on their condition. But we find out that for the most part, the benefit is not really, it's kind of a little bit kind of diffuse, and people don't really pay much attention because it does not affect their life in so much of a meaningful way. Then for something like in vitro fertilization, the benefit is often, we understand, is for those who need IVF. So the benefit is also is actually concentrated. We can define the scope of the people who will benefit from IVF. And then whereas the cost also is, assuming we are paying via a public system, the cost, that means everyone is contributing towards towards IVF care. Then for something like, so the idea here is that more persons, when the costs and the benefits are diffuse, there's likely not gonna be, in fact, for the most part, there will not be any clear opposition to such policies, and the lawmakers can easily have their way in such policy topics. They will easily have their way because there wouldn't be any significant opposition. They can implement whatever they want to implement since there's no actual or tangible opposition to implementing the policy. But when the benefits are concentrated, that means what will happen, and the cost is diffuse. That means those who are people who enjoy the concentrated benefits will what will happen is that they will rally in support of the policy. But since the cost is diffuse, there will likely not be any clear opposition to that policy idea. So we'll see people who will organize are likely going to be the beneficiaries who organize around that topic or that issue. Whereas the general public are really not really interested per se. It does not really affect them in a meaningful way. Then in the case of when there's concentrated costs but diffuse benefits, what often happens is that those who the cost will affect more, those groups are going to organize. So they'll mount a strong opposition on that issue. That's what is going to be the case. But there may not be any strong beneficiaries to mobilize in support. So such policies are likely not going to gain traction and might not succeed or might not be eventually implemented. I mean, then in the case where there are both concentrated benefit and costs, so that will be a highly contested issue. The opposing sides and those who are for would organize and would be a highly conflicting and contested issue. So there will be strong oppositions, there will be strong supporters, and it may hit up the polity. Does anyone have any question about this? Trying to explain the diffuse costs and benefits and how interest will react to them. Okay.
But why there would be a lot of opposition if the cost is concentrated and so is the benefit? Is it because like the people who are getting the benefit are not the ones paying the cost? Is that why there would be an opposition?
Yeah. Remember, when it is concentrated, that means it's usually smaller number of persons, and the impact would also likely be great. Like they will actually feel it enormously. So those who are bearing the brunt of would want to organize in opposition. Did that help?
And then what supports like supporting the cause?
Yeah, those who will benefit obviously would also rise in support. That's why it's going to be a highly contested policy area, because the opposing sides and those who are benefiting those who are bearing the cost and those who are benefiting would organize to defend their interests. But one of the things you may also learn is that adding to the idea of dominant, repressed, and the aspect of those who are challenging, one of the things you also learn is that the dominant interest groups are most likely going to succeed in assuming one of the things you also learn about policy is that a way to frame it is that when the interest of the dominant group, when their interest is not affected, or when their position, their privileges, advantages are not affected or are not being challenged by a particular policy, they will likely be indifferent about that policy, and that policy may easily pass. For instance, let me use this. I'm going back to my healthcare examples again. An example would be, let's talk about like physicians right now. There are other professionals that also want, let's say the nurses may be mobilizing around better payments or better remuneration, better work conditions. As far as the physicians themselves, what the nurses are asking for is just better pay. But let's say they're not asking to take the position of the physicians to earn as high as the physicians, or to be in the policy tables that the physicians are currently placed. They are not asking for them to lead positions in the hospitals or in different health facilities that physicians currently man or are currently in or occupying. In such a case, the physicians, it does not affect them. Nurses just want better working condition, and the physicians themselves, they are still getting or getting what, or still occupying the position that they have in the healthcare system. So they are indifferent. So anything that the government is able to do to assuage the nurses or to make the nurses feel better without actually affecting what the physicians themselves already where they're already placed in the healthcare system. So the physicians will not resist, and nurses are likely gonna get the better working conditions that they are asking for. That is just. Well, however, if their ask is for them to be like, oh, I want to be the kind of consultants the physicians are. We want to do the kind of works that they do, the kind of roles that they perform. We want to head the healthcare facilities, let's say the hospitals. We want to be the chief medical directors, all this kind of stuff. in this case, they are beginning to encroach into the tough and into the dominant privileges or positions that the physicians themselves are already enjoying and occupying and enjoying. So they will face stiff resistance from the physician groups. That would often be the case in such a situation. But you can imagine the two scenarios. One, the dominant interest we have in the healthcare system, which you also read in the papers that we did read, are the physicians. And there, that's something that is widely known. They've been there for several years, and they're usually the head of most facilities. They are usually the head of most healthcare facilities. Even in the healthcare system, they are often the ones that are at the helm of affairs. Although the aspect of regionalization is trying to also reduce or attenuate some of those powers that they have, although not yet successful. And I must say that's, however, very importantly, once the dominant group's interest is not being threatened, what will happen is that such policies or such initiatives or programs would eventually succeed. But if they are not challenged, and if it's something that it's like kind of diffuse and does not really affect them in any way or in a meaningful way, they might be indifferent. They may even support such policies, or if they don't support, they might just be indifferent and just allow or let them just do their thing. There won't be any resistance, and that means the other group would likely get what they want. Any other question? Is that clear? All right. So here, just this is something that we've talked about this when we talked about the institutions, right? You guys, I touched on this when I talked on that's week 2. So all this I believe we already know this, and we know that the monarch and the governor general is the monarch's representative in Canada. Uh and and then know about the executive branch and the legislative branch as well as the judicial branch. So we already know this. So since we've talked about this, I won't spend time on this. I just wanted to provide an overview of this initially. And obviously legislatures. But I have one question. We also know that it's at many a times we have the external committees or some committees being set up by, let's say, the parliament, a parliamentary committee of experts. Why? What do you think might be the rationale for setting up such committees? Anybody? Just one person because of time, so that will be faster. Anybody? Just one person. Okay, yeah.
I think for-
Balance.
Yeah.
Okay, thank you. Just one last question, Julie.
Also like to create that balance.
Yeah, that's interesting. Yeah, I just wanted to understand, hear what you might think about it. Well, mostly it's often to get expert knowledge, people who have expert knowledge or content area expertise on that particular issue, trying to get their input. That's where the things like when we talk about evidence, last week we talked about ideas, including the knowledge and the value components, right? So yeah, they are trying to get people who have the content area expertise to generate evidence to support policies. That's the idea. That's why most of these committees are being this external committee that includes experts in a particular area, content area experts are being brought in. So, and then bureaucracy is also, this is a word we hear a lot about bureaucracy. Bureaucracy is often, when we talk about bureaucracy, trying to paraphrase, is basically about it's about the people in the public service or civil service, where people in the civil service, how we know that people in the civil service play an important role in government, they even many, if not most policies or decisions are actually made by people in civil service. These are people in that are permanently placed, unlike the elected officials that maybe they might be there for one time, two times, or more than two times, depending on how long the person is able to stay in government. Maybe with change in government, this party comes in, the other party takes over after some years. But people in civil service who are the bureaucracies are the ones who are permanent people. They are the ones who who know uh, what has been done over the years. Many individuals have worked in government for 20 years. When I talk about government, I mean the ministries and agencies of government. They've worked there for 20 years, 25 years, 30 years, or thereabouts. So, and they've known about some legacy policy issues, and they can also learn from other things from the past. They know how the system works. They know how decisions have been made over time, and they inform decisions, government decisions in key issues. For instance, the Ministry of Health, we know about how the bureaucrats in the healthcare system, the Ministry of Health, play important role in decision making. So they support the elected officials. However, they still make most of the important decisions. I remember when I did my mini policy analysis during my PhD, when I did the health policy analysis course, I spoke with some of the people who sat in the Premier's Council on improving the healthcare system and ending hallway healthcare, or what is called hallway medicine. So I spoke with some of the people who were in that committee, and one of the things I learned is that even the policy package that they eventually implemented or chose yeah, they were there for a limited time, but people in government, in the civil servants, were the ones who gave them the policies that they eventually implemented. So that's one of the examples that helped me to really understand this better. Yeah, they did their work. There were public consultations. There were some other things that they did to gather or generate evidence about what people want. Yet the package that was implemented was still given to them by the civil servants. These civil servants are people, they also work with some other experts. They work with academics and some other experts and think tanks to generate evidence. When we talk about in agenda setting in week 9, we'll talk about the policy stream. We'll talk about what we call the primordial soup. So during that, we'll go into a little bit more detail about this aspect. This is about the evidence lying around on a particular topic, policy issue. So then when the policy window opens, this evidence or this likely policy solutions are drawn upon and implemented in response to that policy window that has opened. So that's often the case, and the bureaucracies or the people who are in civil service are often the ones that are embedded in the system to bring up some of these packages and ensure that obviously they're getting it from existing evidence, working with think tanks, working with researchers and academics, and then they assemble this into a package that is given to the lawmakers or the executives or the minister or whoever. So yeah, the think tanks these are basically researchers or institutes or experts who are working on, often they might be independent contractors working on a particular policy issue or particular research topic area, generating evidence to inform or support policy decisions. It could be about housing, it could be about healthcare, it could be about anything whatsoever. It could be about environmental issues or whatsoever. But that's who they are and that's what they do. They just generate an evidence and in a bid to support evidence-informed decision making by governments. And then the mass media, like I've highlighted before, basically how the media frames issues, how they influence public perceptions, and influence even how people what is eventually seen as the best response to a policy issue. Then the publics, which are we, the ordinary citizens, or everyone out there, basically about how we also are involved in the policy system. Yeah, not in a more in a clearer way, like some of these organized interests and forces anyway. But however, the public themselves, it may take mass mobilization and more efforts at mobilization, especially an issue that really pinches on or touches the public very well, like the climate change march that we saw the pictures of, and even the Freedom Convoy that was highly supported by a large chunk of the population anyway, not everyone, but a substantial portion of the population of Canadians supported it. Some did not. But yeah, it has to be something drastic to actually get the masses to come up and support and exert their own influence in the policy topic. Then when we talk about power, I think I've already tried to explain this before. Power, which is basically the degree to which one or a group, the extent to which an individual or let's say a group exert themselves or exert some influence in terms of influence behaviors or influence policies. So for instance, when we have the sources of power like we have here, like the professional knowledge. I've already talked about how because of the privileged knowledge of the physicians or other clinicians, they have a knowledge that the public or the patients do not have. So because of that, they themselves are they enjoy this advantage and this power because they have this professional knowledge that the ordinary layperson does not have. So because of that knowledge or informational advantage, they have power over over the rest of the population. And then the structural aspect, which we'll talk in subsequent slides, and then the countervailing power is just about being able to exert opposite force or power over a particular issue, let's say in a particular issue, being able to also exert oppose a particular policy or interest, like we'll talk about in subsequent slides as well. Good. So the structural interests are different from interest groups themselves. This is about, we're talking about power or sources of power. So here we talk about power is exerted and interest are served through organizations and how they are arranged in society. This is basically what this simply means is that one's position in the healthcare system, whether they're like I've talked about the physicians being the dominant interest groups or interest groups in the healthcare system. So with that, their dominant position in the healthcare system, so they are a strong interest group. Whereas those who are not in such positions, like let's say the patients are not strong interest groups in this case, except that we also understand that right now we are not experiencing a shift where patient-centeredness or patient-centered care or model of care has become the in thing that's what is mainstream right now. So there's now more emphasis on patients being at the center of care. But nevertheless, it has not achieved its full potential or potentials because physicians are still the strong interest group. They still exert a lot of influence in the healthcare system. So here I'll talk about dominant groups, like I've tried to explain. These are those who benefit from existing institutional structures. The challenging ones are those who attempt to become the dominant group, if maybe not necessarily become the dominant group, but also try to weaken the power of the dominant groups, like the impact of regionalization of the healthcare system. One of the things it's done is that it has placed at least some level of safeguards or checks and balances for the dominant interest groups, ensuring that, yeah, the physicians, yeah, we know that you are this strong interest group, but we want to at least monitor your works, ensure compliance, ensure put some checks and balances here and there. Even in the government, or apart from this health, even in government itself, we understand that the legislatives are also there to provide oversight function for the executives, right? And in the same way, that's also one of the things that the challenging interest groups, like when we talk about the regional health authorities, that's also what they are also the kind of effect that they are also exerting. And one of the rationale is that, yeah, want to do what is in the best interest of the patient. We have this group of this patient population within our catchment. So we want to ensure that their health needs are met. We want to ensure that physicians are not taking advantage of them. We want to ensure that they are receiving the right care. We want to ensure that they are not paying more for the services that they are receiving, all those kind of ideas. So it's trying to challenge the dominant group, whereas the repressed groups are often those who are not able to exert much influence, like the patients, for instance, like we know. It will take a lot of organizing and mobilization to actually get the repressed groups to actually make any tangible um have any tangible power 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 so I say express more power than what they currently express because of their position in the grand scheme of things. So I talked about these lines before and this. So I think I would want to ask if there's any question before we go into the presentations. And yeah, these are just some questions to guide you when you want to think about interest. And I hope those who will present next week might also draw from some of these questions during their presentation. All right, so any question?